Hello, everybody. Hello, everybody, dear friends. It's such a pleasure for me to welcome you to this online event. The Rome Consensus 2.0 initiative is starting to grow and to circulate more and more all around the world. And this is a good news, but much more needs to be done to be heard by governments to inspire them for a new humanitarian drug policy. This advocacy tool has the purpose to inspire everyone that works in the field of drugs in order to create a stronger partnership that can unify the voice and the will of many professionals, activists, and people suffering under the protective and neutral emblem of the Red Cross and the Red Crescent. Humanity has done a lot of mistakes in the fight against the drugs. The big illusion that lead the approach of many governments supported by public opinion has been mostly punitive, with a wide use of prisons and tribunals. The great illusion behind this still dominant strategy is that if the person who used drug realizes that drug use carries punitive consequences, this is the best way to let him to stop. This apparently logical prejudice, however, is contradicted by reality. Those who suffer from the consequences of drug use will suffer even more from a punitive policy against them, and drugs will still appear to be the only viable solution. We believe that treatment and punishment can't work together. Treating people with drug disorders is a common interest for all humanity, for all the government, for each community, in order to have healthier, peaceful, and secure communities. This is the common basic mission of Rome Consensus support. We invited today leaders of different organizations from the 5 corners of the globe, the 5 continents, to dialogue, know better each other, learn and combat together all the obstacles that impede people with drug problems to get cured and safe in their communities. Those countries and policymakers that keep ignoring the contradiction between punishment and treatment go against their own interest. The humanitarian perspective is the milestone of our daily work, and we will make all the noise and action needed to be heard and supported in this common challenge. One of the founders and co-chair of the Rome Consensus, Ben Levenson from Levenson Foundation, is the moderator of our meeting, and I am happy and honored to give him the floor. So, Ben, the floor is yours.
Thank you so much, Massimo, and thank you for leading us as a team on some of the most important work we'll do. And welcome to everyone in attendance. My name is Ben Levenson, and I am a co-chair of Rome Consensus. And we're excited that you've joined us today as we mark the World Drug Day event together with Support Don't Punish in a format entitled Humanitarian Drug Policy Across the 5 Continents. Just a couple of housekeeping items. Today's session is being recorded so that it's available post-webinar. And our fantastic presenters today will have between 4 and 6 minutes to complete their presentation. If one of our presenters completes their presentation before that's up, or if we're able to move through this in a timely way, we will have time at the end for questions from attendees. And in that regard, please direct your questions to the Q&A area. We're not going to be monitoring the chat section for questions, but we do encourage participation there, but be sure to put your questions in the Q&A. Our main goal at Rome Consensus is to provide a call to action in care of those who suffer discrimination, torture, deprivation of health, and social support of their rights and dignity to simplify, just simply because they use drugs. And now our work is to establish a wider alliance among activists and professionals, beneficiaries and NGOs working in the field. Our partners in humanity, really, especially in this stigmatized field, to help illuminate an international discussion on how to best respond to drug use and to the people who use them. I want to introduce first Elie Aaraj. Elie is the executive director and founder of MENAHRA, the Middle East and North Africa Harm Reduction Association. He's based in Lebanon. Mr. Aaraj began his work in the field of HIV and AIDS and harm reduction in 1987. In 2007, Mr. Aaraj became one of the founders of MENAHRA Network and has been its executive director since that time. He is also the current president of the regional Arab Network against AIDS, that's RANAA, RANA. And alongside his employment, Mr. Aaraj undertakes many other professional activities, mainly focusing on the prevention and treatment of substance misuse, harm reduction, and HIV. He has also published many major pieces of research on drug use and drug user health, among others, and as well as numerous resources for practitioners in the field. So without further delay, we welcome you, Elie, to the stage.
Thank you, Ben. Thank you, Rome Consensus, for giving me this opportunity to be here with you and to speak amongst the experts from the 5 continents. Thanks to Rome Consensus and to the Red Cross, Red Crescent as well. In this 5-6 minutes, I'll try to go direct to the point, just to show you what is the situation in the region. First, we need to know that in the MENA region, we have the biggest number of refugees due to the insecurity situation that is facing that faced more than 11 countries in the region. This showed that because of the situation, many problems become priority than the HIV health or drug policies. This is why our work is becoming very difficult. I can tell you that we conducted lately and we published a situation assessment in 20 countries of the MENA region. And we estimate having more than 1.1 million person who is injecting drugs. In front of this, we are in this region, we are at a very weak coverage in terms of ARV for people who are living with HIV, but also in terms of needle and syringe programs. And here, when I say very weak coverage, I'm talking about the geographical coverage, but also number of syringe per person. We are witnessing, due to the situations, be it economical or security situation in some countries, we are facing the decrease of the age of first use in drugs. Talking about that, we can see in front of this, we can see that most of these countries are still having repressive laws. Governments are investing in law enforcement, in prisons, imprisonment, etc., more than we are investing in harm reduction. The repressive laws, as we all know, lead to somehow to people who use drugs not to seek services, and this has put them on a higher risk. In this region also, we have more than 6 countries that still have death penalty for drug use. And I think this is very, very dangerous. And we are at the level of starting to work with other networks and other colleagues and experts in the region to raise the voice and to go for an advocacy campaign. If we want to talk about harm reduction, I can tell you that we have some successful story as well. We have, for example, in Lebanon and Morocco, who are the lead countries in terms of implementing harm reduction activities. Some other countries have the harm reduction in their strategic planning, but not in their implementation programs. I can tell you, for example, in Lebanon, it's the 6th year without any new HIV infection among people who inject drugs. So there are some successful stories, but there are some other problems. And one of the major problems is that the drug policy, HIV, and harm reduction are not at the government's agenda. And this is shown by not having any budget for this as well. So this is why the civil society organizations are leading the process of providing services for people who use drugs in general in the region. But we are also suffering from the lack of funding because of the absence of the governments on this agenda. So we, as I mentioned, we have a lot to do. We are preparing for an advocacy campaign. We need the support, for technical and financial support in the region. And as well, as I mentioned, people who use drugs are also trying to start showing themselves, expressing their needs. And we have now a new network called MENAHRA network of people who use drugs, that is supported by MENAHRA, and very soon they will be registered and they will work independently. I'd be ready also to answer any question if you think that we need it. Thank you.
Elie, thank you so much for that and for providing some visibility into the corner of the world that you work in. We all are grateful for your courage and your brilliance over all of these decades. So thank you so much for that. I'm excited to next welcome Mr. Elliot Pinsley. Elliot is a licensed clinical social worker in Nashville, Tennessee. He is the president and chief executive officer at the Behavioral Health Foundation, which is also headquartered in Nashville. It is an independent nonprofit policy center that drives systems change through data-driven policy research, strategic collaboration, and actionable education. Mr. Pinsley is also the co-chair for the Tennessee Diversion Coalition, which is a state-funded group advancing pre-arrest deflection, diversion, and emergency mental health transportation reform. In addition, he also serves as on the National Leadership Council as a member of the Police Treatment and Community Collaborative, otherwise known as PTACC. And there's more information on not only Elliot, all our presenters online. So with that, we welcome Elliot.
Ben, thank you so much. Really appreciate you and the Levenson Foundation for helping to host this event. Thank you to Massimo and the team behind the Rome Consensus 2.0 for putting together this event in collaboration with the Worthy Support Don't Punish campaign in celebration of the upcoming World Drug Day later on after this week concludes. So really honored to be here representing the United States and this wonderful group of people. I feel just honored and humbled to be among such leaders and experts in this field, and hope to share some information about what we're doing in the United States, and specifically in one small part of it, which Tennessee, where I'm from, and hopefully share some information, learn from you all. And again, just very happy to be here. So also thank you to everyone watching. Just the fact that you're here, participating, watching, listening, this is huge. This is important. We all need to collaborate. We all need to learn. We all need to be talking about these things if we want to work toward real change in policies and systems. So all of you deserve a pat on the back for just being here listening. And those, my fellow panelists, again, thank you so much. So I'm again, appreciate the introduction, but I'm the president and CEO of a relatively new nonprofit organization based in Nashville called the Behavioral Health Foundation. We are a policy center. We're independent. We're non-political. We are just trying to advance really helpful mental health and addiction related policies that will help people have access to care and avoid people getting arrested when they can be better served in their community. So in addition to my role with the Behavioral Health Foundation, as Ben mentioned, I co-chair the Tennessee Diversion Coalition, which is a state focus group that looks at trying to expand pre-arrest diversion and deflection efforts, expand 24/7 crisis walk-in centers, and we've been working on emergency mental health transportation reform as well, trying to find ways to make sure we get folks to care without putting handcuffs on them if they have committed no crime. So that's really great work at the state level, and then moving to national and the international level. That's why I and the Behavioral Health Foundation decided to join PTACC, the Police Treatment and Community Collaborative, which is a founding partner of the Rome Consensus 2.0. And if it hasn't been said already, please sign the Rome Consensus 2.0 if you've not already. It's just a tremendous document and effort, and we need all the support we can get. But PTACC is an alliance of practitioners in law enforcement, behavioral health, community advocacy, research, and public policy, with the mission to strategically widen community behavioral health and social service options available through law enforcement, diversion, and deflection. I'm very excited to announce that PTACC has launched a new international deflection and diversion strategy area, which I am honored to co-chair along with Michelle Warabik from the National Alliance for Model State Drug Laws. So we're just getting started with that group, and we hope to work with all of you here to learn about what you're doing, see what we can share, but mostly learn and just collaborate so we can work together to advance efforts to get more pathways to keeping people out of jail and into getting them into care. So beyond that, so I want to talk about Tennessee. Really, it's the United States, but I'll talk about what we're doing in Tennessee, and then before I turn it over to my fellow panelists. The issue I want to bring up to this group's attention is surrounding fentanyl test strips. As most of you probably know, and in most areas of the world, fentanyl has become just a tremendously dangerous drug. There are legal formulations, but we're seeing deaths increasing and just rapidly from fentanyl overdose deaths. This is not just from things that are supposed to have just fentanyl in them. This is a very powerful opioid, very much stronger than most of the other opioids that you may be familiar with. But the problem we're seeing is that drug suppliers are putting fentanyl into all sorts of different substances, including those that people would not expect to see fentanyl in. These include pills that are pressed to look like Xanax or Valium or any other common pills that people may take that normally would come from a prescription bottle. So they look like they're the real thing, but they may have fentanyl in them. And we're seeing people die, and people are literally dying from taking sometimes a single pill. This is not a scare tactic. This is true life and really what we're seeing here. So in Tennessee, we saw more than a 500% increase in fentanyl overdose deaths from 2015 to 2019. That's huge, but 5 years, more than 500%. And that's compared to a 44% overall increase in drug overdose deaths during that same time. So you can see that we're having a major concern here with fentanyl and why we want to do something about it. But in April 2021, the United States government from SAMHSA and the CDC, they released new guidance that specifically allows the use of federal grant dollars to pay for the purchase and distribution of fentanyl test strips to help prevent overdoses and slow the opioid epidemic. Fentanyl test strips are essentially a piece of paper, kind of like litmus test, you put it in a bag or a jar that has a little bit of residue from drugs with a little water, and it will tell you one line, yes, there's fentanyl or one of its analogs, or two lines, no, there's not. And it costs about $1 per test strip in the United States. So you can see this is very inexpensive, and research shows that the act of testing drugs with fentanyl test strips often results in significant behavior changes that we want to see, including using a smaller dose, making sure to have naloxone nearby in the event of an overdose, seeking support from another person, and in many cases, not using the substance at all. So this is very clearly something that can help prevent overdoses and overdose deaths, and help people become more educated about what they're doing, and hopefully get more people into care who may need it. The problem is these are illegal in most of the United States. They fall under drug paraphernalia laws. So what we know from research and from our government to say at a federal level that these are good, most states will not allow distribution. They are considered, as I said, drug paraphernalia. In Tennessee, it's a misdemeanor crime to possess, and it's a felony to distribute. So you can see why there might be hesitancy among folks to want to purchase or provide these. So what we've done is we've investigated our law, and we've talked to other states. We know that Maryland, North Carolina, Colorado, Virginia, Rhode Island, and the District of Columbia have already passed laws that have exempted testing equipment from their drug paraphernalia laws to allow this harm reduction method to be used. So I and others worked with folks in North Carolina. We got their model legislation, and we have submitted a legislative proposal to our State Department of Mental Health and Substance Use Services to see if they will consider sending this to the governor for formal legislative action. And if that doesn't happen, we're going to be pursuing this from a community advocacy perspective. So these are efforts ongoing here. There's so many issues I could tell you about that we need to be looking at, and that we are. And I hope to learn more from all of you all to see what's important in your area. And if anybody's interested in this topic or has ideas or successes, please reach out and let's work together. So thank you again. And I look forward to the question and answer portion of this event.
Elliot, thank you so much, and really appreciate you highlighting some of the nuance and complexity that drug users in the United States are currently facing. We're really not in a prescription opioid crisis. We are in a poisoned drug supply overdose crisis. And having rejected harm reduction for drug users for the last 40 years, we find ourselves without the exact practices that we need in order to preserve life and improve health and safety. So thanks again for focusing on that. I'd like to introduce Greg Chipp. Greg is a founder and managing director of Drug Policy Australia. Greg has been actively involved in politics and public policy for several decades, beginning with his involvement in the Australian Democrats, which is a centrist political party established by his father in the 1970s. Having recovered from his own addiction in the 90s, Greg brings an understanding of the obstacles of discrimination and prejudice resulting from the criminalization of drug users. Greg is one of the most active and longest serving advocates for drug law reform in Australia. We're so glad that you're here with us today and excited to learn about what's going on in Australia. So Greg, welcome to the stage.
There we go. I just said after a quiet start. Look, Ben, thank you so much for those kind words. And Massimo, just thrilled to be part of the Rome Consensus. I read it online and I was inspired by the words and the aims and objectives of it. It's just so exciting to be involved in a worldwide movement for human rights. I see it as a struggle similar to the struggle against slavery or gay rights or racism. These social causes, they take years to come into effect. I remember when I was a young bloke, we still had laws in this country that criminalised a love between two people. And we look today with last couple of years, Australia has legalised gay marriage. The point is not to canvass those issues, but simply to say that issues, social policies do change over time with the work of good people like yourselves across the world. That's why I'm just so thrilled to be involved. Look, like Elliot was saying with his charity, we are a smallish charity in Australia trying to do our bit to pursue this issue on behalf of everybody, not just people that use drugs, but mums and dads, parents, families, these people that suffers. And a forgotten part of the suffering is the second generation. When a dad goes to jail, his kids are stigmatized, and there's so many ongoing consequences that really breaks your heart to passion. And as Ben said at the start there, I have my own lived experience in this, and I guess my motivation for pursuing this issue is, but for the grace of God, there go I. That, we good people that I guess had a good life, and I've had a good run with a number of things, owe it to put something back to the world's conscience, something that's been missing due to what really originated in America 50 and even 100 years ago, which was, the international prohibition. Never has the world had such unanimity on any single issue except the drug prohibition. And it was spread, no aspersion to America, I love America, but at the end of the Second World War, the 40s and 50s, at the zenith of the American power after the Second World War, across the entire globe. And we now suffer, and I say we, I'm talking about hundreds of millions of people over the last 50 years that have suffered at the hands of these drug laws. And ironically, America, with the high incarceration rates, has suffered more than anyone. And Elliot, look, it's just heartbreaking when I know the deaths of overdoses from fentanyl in America, and heartbreaking to hear you say that the government, for some reason, won't allow this simple life-saving tool, which, as you say, it costs $1. It's a strip that basically will tell if the substance is fentanyl is potentially dangerous. The world is such a various areas of different sorts of activities in terms of drugs and enforcement. Australia once was a world leader in terms of harm reduction, and a number of ways we've gone backwards due to very hard-line government policies here, and that's what I just want to touch on, is what is happening in Australia. We don't have any states with full drug decriminalisation, which is the ultimate goal, I guess, of our charity, to stop criminalising, arresting people for doing what really is a human action of delving into your own consciousness, whether it be with drugs or twisting around in the playground when you're a kid and getting dizzy and having an alternative state of mind. It's as natural as life itself. And to criminalise that behaviour has so many consequences. Australia is a jurisdiction of 6 states. No state has fully decriminalised drugs. We have a little bit of decriminalisation of cannabis. We have no legal regulation of cannabis in Australia. As an advocacy charity, we are pursuing the goal, and this is our ultimate goal in terms of undoing the prohibition, is the legal regulation of all drugs. As difficult as that sounds, or as difficult a goal as that sounds, that is the goal of us as an advocacy organisation in Australia. And by legal regulation, we mean prescribing heroin to a long-time addict, as is done in Switzerland, with massive harm reduction and saving of life. The legal regulation of other drugs, perhaps cannabis and MDMA, is on the agenda here. It is attainable in time, and there's a harm quality control. It's a taxation to be turned into services for people that are afflicted by drug issues. The legal regulation is a goal. And when I say it's sort of on the agenda here, we've had a very conservative state in Australia, had a productivity commission, which is a statutory body that inquired into recidivism, and this will be related to your area of work, Elliot, in terms of prisoners and the the cost of incarcerating prisoners in Queensland, and it was put at $110,000 per year per person. And this Productivity Commission, on a pure dollars and cents argument, said we should legally regulate MDMA and cannabis because their harm profile is not as dangerous as currently legal drugs. And they said the state would save $600,000 per year. $600 million, almost $1 billion per year by legal regulation. So that's the end goal. The government remains staunchly opposed to even entertaining decriminalisation, little irrational regulation. New South Wales, our largest, most populous state here, has had a coroner's inquiry that recommended the full decriminalisation of all drugs. The government, again, staunchly just said no way for political reasons and won't entertain the idea. We had an ICE inquiry, a high-level government inquiry, spent millions of dollars on it. It recommended decriminalisation. So the point I'm saying is there is a groundswell in Australia to radically change these laws. It will occur, and I'm not sure on time here. Ben, scratch your nose if I'm over time. Give me a heads up. Decriminalisation of drugs will happen eventually. We're taking our lead, ironically enough, from America. And I can't proceed and finish up without commenting on the massive step that's happened in America in the state of Oregon on the 1st of February this year. It's enormous, and it, I guess, inspires me to believe that we can get this thing done in a shorter time frame. Oregon decriminalised all drugs, massive harm reduction technique. An irony, because the home of the prohibition, which is really what America is, has decriminalised, and it is really leading the world that we can undo this horrific and injustice that's been perpetrated on all of humanity for the last 50 years. Thank you very much, and yes, open for any questions that we have time.
Chipp, Greg, thanks so much for that. We won't mince words. One of the most unsavory gifts the United States has given the world is the concept of prohibition, which is really not the most stringent form of regulation, but really the abdication of the responsibility to regulate for the common good and safety. And the consequences of that are incalculable and pervasive, particularly when it comes to populations of color who have massively disparate consequences and harms from the asymmetrical application of drug law. Melissa Peters was scheduled to speak next. She is the Education Program Coordinator and Harm Reduction Specialist for the University of Alberta, as well as the Institute for Sexual Minority Studies and Services. And unfortunately, she is experiencing some technical difficulties. So we'll work to bring her back during a later event. So having said that, we're going to move on with Shay. Shay KEHINDE is the co-executive director and advocacy manager of YouthRISE in Nigeria. Shay is focused on drug policy, harm reduction, human rights, women who use drugs, and access to HIV and sexual reproductive health interventions. YouthRISE Nigeria envisions an initiative with a mission to promote evidence-based policies and development with the meaningful involvement of young people and most affected communities. YouthRISE Nigeria is a recipient of the UN AIDS Red Ribbon Award and holds special consultative status with the United Nations Economic and Social Council. So again, Shay, we're very excited to have you here today, and we welcome you to the stage.
Thank you very much, Benjamin, and everyone on the call today. It's a pleasure to be here. I'm a part of this very, very important conversation. Not to waste so much of the time, just a little background, and a context to the drug situation in Nigeria. In recent times, Nigeria has experienced a surge, in drug consumption and drug availability. Before now, Nigeria was considered to be a drug trafficking route. Looking at the movement of drugs from Latin America, and Asia, to North America and European markets. But in very recent times, the country has actually become a huge drug consumption, hub, and also a drug-producing country. Given the discovery of some clandestine methamphetamine laboratories in the country, and even the growth and cultivation, of cannabis in the country. Of course, in response to this issue, Nigeria implements a reactionary and punitive drug policy. Nigeria is known to implement one of the most draconian drug laws in the world. Our drug law actually prescribes a term of not less than 15 years, to 25 years imprisonment, for drug-related offenses. The law does not differentiate between a user and a dealer or a trafficker. The law does not speak to threshold. So basically, given what the law says literally, you are liable to face a term of 15 to 25 years imprisonment for even a simple wrap of cannabis, And over time we have seen how this has led to gross human rights violations, by law enforcement under the guise of drug control. We've also seen a huge public health crisis, given the strong link between injecting drug use and and HIV, hepatitis, and other bloodborne diseases, and then lack of availability. So excuse me. Sorry about that. And we've seen a spike in public health crisis in the country. And also the key point is stigma and discrimination, which has been reinforced by, of course, the criminal disposition, or should I say the criminal approach, to drug use, and also negative perception, and public opinion, around drug use. And of course, if you look at the National Drug Use Survey conducted by the United Nations Office on Drugs and Crime, on drug use in Nigeria, of course, it says they have about 14.3 million people using drugs in Nigeria, and if you look at that as a percentage, you see about 14.4%, and of course, a lot of times you hear a lot of policymakers talk about, yes, how drug use is really huge in the country, how young people abuse drugs. But one thing policymakers and the general public refuse to talk about is also another section of that document that speaks to barriers to treatment. Even in the line of work, I meet a lot of young drug users who actually need treatment. But number one is many of them cannot even afford the treatment. Many of them do not even have information. And a key part of it is also how stigma and discrimination, has also, driven people use drugs on the ground. So at YouthRISE, we carry out a lot of community-based interventions and outreach. And over the years, of course, we have been able to build a strong relationship with the community, our work with the community. But I can tell you that there's still a lot of fear, among people who use drugs, out of the fear of, stigma and discrimination. And it's even huge. It's worse for women who use drugs, because Nigeria, and should I say indeed the African continent, is very religious, and drug use is viewed through the moral lens, and also looking at patriarchy as well, So women who use drugs are labeled, many of them are not even comfortable, to come out to seek help, or even speak openly about their drug use issues, And and over the years, even with the fact that Nigeria implements a punitive drug policy, drug use has not reduced in the country. Of course, in recent times, I wouldn't say it's been all gloomy. In recent times, we've experienced some sort of silver lining, given how in 2019 the government actually approved the implementation of comprehensive harm reduction, inclusive of a needle syringe program, in the country. At least for us here, that's a win. And the last year we actually had a pilot, just to see or prove how effective needle syringe program is in the country. We're still working around that actually, and also make a case for the government. So this is the context and the current situation in Nigeria. As an organization, of course, we carry out advocacy, engage with the public and key stakeholders on the need to adopt a public health and human rights approach to drug use, as opposed to the current punitive approach to drug use, and even we do prevention, majority of the focus is on the use of scare tactics. I tell young people, say no to drugs are bad, but of course, evidence has shown that is not an effective drug prevention strategy, so many times, right, we engage in drug prevention programs as well, by focusing on life skills, and also carrying out harm reduction as well, to ensure that that people who use drugs are protected, from drug-related harms as well, and also make a case to the government, because right now our response is tilted towards the supply reduction. And of course, we know that is not an effective drug control approach. An effective drug control approach has to be holistic. It has to be multi-sectorial. And of course, given the huge influence that religious sector plays in Nigeria, as an organization, we focused on building capacity of religious leaders as well. On evidence-based drug use, treatment and care. Also, the media has also not been so helpful, with this negative, narrative, around drug use. And as an organization, we work to build a capacity, of the media, not to put out sensational, reports about drug use, but to focus on the facts, and actually enlighten, key stakeholders and the general public, giving them evidence-based information. And we have a campaign, and it's called We Are People. So it's strongly aligned, or shall I say, it's a local variant of the Support Don't Punish campaign, saying basically, as a drug user, you're actually human, and the fact that you're a drug user does not strip you of your fundamental human rights. Yes, you deserve the right to health. You deserve to be listened to, to be heard. So basically, yes, we have a campaign which has grown locally in Nigeria over time. And just to wrap up, of course, let's not just focus on the negatives, and the context. Of course, one of the key recommendations is to continue to educate the public, using the media and also through training platforms, educate the public on evidence-based drug prevention, treatment and care, yes, and also engage different strategies in also engaging policymakers, for them to really understand. For example, right now, there's a growing conversation around legal regulation of cannabis, and there's a lot of misconception. Locally down here, a lot of people think decriminalization is the same thing as legalization. I know some of the things we've been trying to, meet and misconceptions, I've been trying to actually address, as an organization. And I'd like to end my presentation, quoting the late UN Secretary General and late Kofi Annan. He said something. He said, drugs have destroyed, many lives, but wrong drug policies have destroyed many more. So this emphasizes the need for us to really examine and probe our drug control approach, and ask, is our drug control approach rooted in the principles of public health? Does it address human rights concerns? And does it support the achievement of the Sustainable Development Goals? Thank you very much.
Well, thanks, Shay, so much for that and for your leadership, not only in Nigeria, but internationally. It's an honor to have you. And also thanks for centering people and highlighting, the autonomy and rights to agency and self-determination that really everyone has, independent, whether they have a substance use disorder or not. So again, thanks for being here and thanks for that. I just want to remind the attendees to put questions in the Q&A. I'm going to turn to Somsri. Somsri is the chief of psychosocial and behavioral group at the Thai Red Cross AIDS Research Center in Bangkok, Thailand. And I think it's important to recognize that this is the only center in the world that does the type of work that they do there under her leadership. And again, we're so grateful to have you, Somsri, and we give you the floor. There you go.
Did you hear me?
Yes.
Okay. It was an honor to serve on a panel for Rome Consensus 2.0, support don't punish toward humanitarian drug policy or World Drugs Day 2021. First of all, for Thailand has the highest prevalence of HIV among countries in Asia, but has also been a pioneer in HIV prevention and treatment effort in the region, reducing the incidence of new infections significantly over the last 2 decades. The Thai Red Cross AIDS Research Center was established as a special unit of the Thai Red Cross Society on November 8, 1989. The Thai Red Cross AIDS Research Center has a leading role in Thailand and the region with regard to prevention, counseling, treatment, and research on HIV and AIDS. By the way, for people who inject drugs, is the illegal in Thailand. So Thai Red Cross never enter for this key population. After the support from Federation and Italy Red Cross and Villa Marini, Thai Red Cross have started to training in Villa Marini. So after back from Villa Marini, we set up the proposal to support for people who inject drugs. So we have youth volunteer and we provide the service in the anonymous clinic. We provide needle selling program exchange for injecting drugs. By the way, because the anonymous clinic, we have like the police counter in front of the clinic. So some people cannot maybe at their attitude or obstacle, they cannot feeling free to provide us that they use inject drug. So just only some few people who inform us, then we can help them. But we know 70% of Thailand prison inmates jail for drug offense. So we provide our service to the people in the jail, in the prison. So we go to the prison for provide education. For HIV prevention, we have 4 categories: provide education, counseling and testing. And if they have HIV positive, we give them access to care and treatment. And support to receive new injecting equipment for those who attend. Also support to use a condom and gel. So this is 4 categories that we can do right now. But by the way, the obstacle for us to maybe the provision of service and content knowledge, text, media, and information dissemination channel were inappropriate for the target audience. The support to use clean needle is not enough to give for injecting people. And in Thailand, nowadays they use more drug but they change not injecting, but they use like smoking or take the pill. That's why we think that we need to adapt our knowledge and try to help people who use drugs more. This is our support that we can provide for people who injecting drugs. And because the attitude of our health personnel still is the major concern. So we try to train and strengthening medical personnel and other officers to have basic knowledge and skill in providing health service to prisoners. And also distribution of educational material and condom material was distributed on every World AIDS Day in all race course branch and in the prison that we can go to support them by the funding of the Asian Red Cross and Red Crescent HIV and AIDS network. This is our work that we done for last for 5 years. That's it for Thai Red Cross. Hello?
Yes, Somsri, has that concluded? Have you concluded your talk?
Yes.
Thank you so much for that. We really appreciate that a lot. We, the Rome Consensus is really the global voice of professionals and advocates to governments in the world, and I think that it recognizes this trend that is finally happening, involving relocating drug use and drug users away from carceral, punitive, justice-based involvement, and moving drug use into health and medically centered frameworks. We are, last but not least, extremely excited to have Dr. Luliia Paskevska. Dr. Paskevska is the head of the Association of Psychological Assistance Specialists and Human Rights Expert, and she comes to us from Ukraine. She is the Associate Professor of State Security at the National Academy of the National Guard of Ukraine. Dr. Paskevska advocates and promotes non-stigmatizing access to and delivery of healthcare and social services for people who use drugs, as well as ensuring the human rights of individuals who are not violated in the criminal justice system. Additionally, Dr. Paskevska has over 10 years experience in the area of prison reform in the Ukraine, specifically to improve the quality and implementation of national human rights strategy. Dr. Paskevska has also authored and co-authored many major articles and publications and legislation, which has been approved and adopted by agencies such as the Ministry of Justice of the Ukraine, the Ministry of Health, as well as the Committee on Legislative Support of Law Enforcement Activities. So thank you so much for being here, Doctor. We look forward to listening to what you have to say. Thank you.
Oh, yeah. Thank you very much. It's very happy to be with you. Thank you for collaboration, Massimo. And I remember our collaboration before. Also, it's very important. And thank you very much for this event, because it's very useful for all of us. We can see the major aspects which we may do it in our country, and also it's one of the necessary way which we can together do it. And now I want to show how in our country, in my country, yes, in Ukraine, what is a drug policy and what about drug policy in my country. So we know, and also we decided in our country that the problem of drug use and trafficking is a global problem that determines the normal development of the country. Also, it's destroyed the health and fate of millions of people, especially young people. For our country, it's very important national policy, because only this time, in this May, in this year, our country Minister of Health promoted and presented the draft of document. It's the document drug policy, national strategy of drug policy until 2013. And also this document only public discussion now, not implemented, but it's very important to us implement it after that, because the strategy is the major document for drug policy in Ukraine. So this document include draft document include the strategy, the following strategic points: prevention of the use of psychoactive substances without medical indication and rising public awareness. Also, stop of illegal production and processing drug, psychotropic substance and precursors. Also, this draft of documents ensuring access to the necessary prevention measures and effective methods of treatment of persons with mental and behavioral disorders due to the use of psychoactive substances. Also included this draft ensuring the rights to treatment and prevention of persons with mental and behavioral disorders due to the use of psychoactive substance. And very important, this way to the penitentiary system. And if you know, I work with prisoners, and also we implemented many rehabilitation program for prisoners which with drug who drug users. Yes, and the main goals of this document, of this strategy for us, it's promotion of a healthy lifestyle, reducing the demand for psychoactive substances. Also very important, ensuring the availability drugs for those who need it. Its treatment for us is very important. And also very important, implementation of the harm reduction programs. Of course, the drug strategy to improve information management algorithm, and is necessary, in particular, development the necessary standards to introduce and integrate information system for conclusion the need drugs, the volume of quotas, their impact, export, production purpose, and release. To develop a system of registration of persons in need of additional treatment and treatment with the use drugs in the electronic health care system. It's very important for our Ukraine. And also this document ensures the exchange of reporting documentation between healthcare institutions of all forms, state, NGOs and others. Also, I work as NGOs and in collaboration with different NGOs in this sphere, drug policy, of course, and NGOs in Ukraine are calling for change in these following aspects. For example, one of them, introduction the latest standards of rehabilitation services, ensuring the availability of naloxone, promoting the adoption of the law, the mental health, changes in the decriminalizations. And also we have some, I have some activities with rehabilitation centers, and I must say that we have some problem with rehabilitation centers in Ukraine. Why? What is the problem with rehabilitation centers? Because some of them work illegal. So not implementation and good support people with drug and alcohol addictions. Also, one of them maybe not give good treatment, and it's a problem now. And for example, one of the rehabilitation center in Chernigov region in our country, so representative of the security service, representatives and detained there by violence to work in human condition instead of full rehabilitations. So they expose the criminal activities of persons who force people, yes, and it's very big problem and very important for our Ukraine. We must changes and initiate changes in the legislation on the establishment of license system of for rehabilitation center. Also, as a result of such activities, several dozen criminal proceedings have been opened, and there are already several convictions. At the legislative level, no regulations have yet been adopted to regulate the existence of rehabilitation center in the legal field. There are no other alternative care facilities for relatives. This issue needs a solution and cooperation between these government agencies and the Minister of Health of Ukraine in order to develop appropriate medical protocols, prevent rehabilitations without medical supervision and its standardization. And the main task is to introduce a system of public monitoring of rehabilitation center, update on permanent basis a single map of rehabilitation centers in Ukraine. And in conclusion, I must say that we must create a system of control over the new drugs, psychotropic substance and precursors. Also, maybe we must know what kind of new drugs now in Ukraine, and also monitoring these and control these. We must form a tolerant attitude to drug addicts at the level of local councils. It's very important in the regional level, not only in the national, in the regional level too is very important, because in the regional level, it's maybe not good drug policy implementation. And also we must carry out joint activities of the Minister of Education and Science of Ukraine and the National Police of Ukraine to promote a healthy lifestyle and negative attitudes towards the use of psychoactive substance among young people. And also we must expand the package of service for drug users, including testing the quality of new psychoactive substances. And of course, for us, it's very important to study the international experience. And these events is very important for us to know and maybe see what kind way you implemented and what kind of treatment, what kind of different ways you implemented in your countries. And also we must propose maybe innovation tools, including the internet, because now online service is very important, and we can also, we have some example, for example, consultation drug users by online. It's very important, and it's one of the way maybe for me of the rehabilitation, of course. So for now, for us in our Ukraine, is very important. It's also, of course, it's implementation our national strategy of drug policy until 2030. And now we work in this way today. Thank you very much for your attention and for our collaboration. Thank you.
Thank you, Dr. Paskevska. We really appreciate your contributions. Again, in this event. And so now is our time. We're going to turn to some questions, but I just want to mention for those who need to go on with their day, please, one of the key things you can do to support the work that we're doing is to visit romeconsensus.com. And there you're able to endorse humanitarian drug policy frameworks that we've set forward and be heard, be included in this extremely important movement. One of the things that I say to my international colleagues who are building systems of care is that I hope they did not look west and just try to build what they think they're seeing. Because, the systems that we have are, hey guys, go on, go see the bar. The systems that we have are,
I'm so sorry.
Have structured hatred. Sorry, everybody. That's part of the Zoom world, right? Have structured hatred and really they're designed to foster harms and starve drug users out of intervention and support, unless they agree to live some perfect version of health. And I completely lost my point because my two beautiful boys came in. But there's a question that we want to get to, which is, will you talk more about the things that we can do in the near term to support or implement the normalization of harm reduction? How can those who are interested in doing more than signing the Rome Consensus, how can they be supportive? I think I'm going to pass that over to Ellie. Ellie, will you talk a little bit about some of the key ways to support harm reduction, or some of your constituents are supporting harm reduction in Lebanon?
Yes, of course. I can say that let's say the political structure is somehow ready now to admit that harm reduction can save lives, that harm reduction also is more an added value and more beneficial to the national economy. I can mention about Lebanon that a few years ago we worked hardly, we advocated with the Ministry of Public Health, and they accepted to support the vaccination of hepatitis B for all people who inject drugs in Lebanon. MENAHRA was coordinating all of this. On another note, as I said, they accepted every single word in the National Strategic Plan, not only the Ministry of Public Health, but it was a common work between 7 ministries concerned, ministries and the civil society organizations, but until now they didn't put any dollar on it. The main issue that we are facing now to somehow increase the response of harm reduction is the economic situation. I can mention also, since you asked me about Lebanon, after the Beirut blast last year, the explosion of Beirut, we had lots of new problems related to the economic and security situation of people who use drugs, people who inject drugs, and all the key population and people living with HIV, because some of them were living beside the explosion and they had the house destructed, etc. But also people are losing their jobs in Lebanon. And those who are specialized, they're leaving. For example, we lost lots of psychiatrists, psychologists, nurses, etc. So there is something that we can do related to service provision in parallel of our work in advocating for drug policy change. On Friday, we will have, we created a consortium for decriminalization from 5 or 6 civil society organizations, and we will have also a webinar addressing Lebanon and the Lebanese laws and the law enforcement and judges. We're trying.
Thank you so much for that that background. We appreciate you sharing on that. I think we want to have one more question here. Yulia, the Rome Consensus is a groundbreaking manifesto. Can you talk a little bit about areas of the humanitarian drug policies that may face more obstacles in terms of implementation?
How we can implementation, you mean?
Yeah, some of the chief challenges or obstacles to implementation as you see it.
Yes. Thank you for your question. So the first, it's economical, financial challenge because many also. The next maybe challenge for us, different views to this strategy, different points. For example, Minister of Health view 1 point, national policy view 1 point, and we must integrate these points together in the strategy. Also, we have some problem with how we can implementation on regional levels, because on national levels we can control how it can be implementation, but after if we look and investigate how it regional levels, it's not good implementation. We haven't all the good rehabilitation center. We haven't good treatments in regional level, and it's a problem for also our implementation strategy. Also, we have some problem, different points and different views from different NGOs, and all the time we discuss how it will be, in what way, and also we must go in one way. It's also a challenge for us for our also implementation. And one of the challenge for our implementation that we have all time different political system, also very often changes our Minister of Health, and that's why the strategy not be implemented and not improved now. That's why only because we must do it maybe 1 year ago, and we must discuss and implement it and improve this strategy, but we do it only now. This challenge for us.
Thank you so much for going into the color on that. We really appreciate your response. Before we go, I just again want to remind everybody in attendance that the domain is romeconsensus.com. And so before we depart, we want to turn to our third co-chair, which is Rick Orstrom. He's chairman of the C4 Recovery Foundation, and just ask Rick if you would just say a few words for us.
Thanks, everybody. Ben, you caught me on the hop. I wasn't expecting to be called on. I've really appreciated the time, and I've certainly been very appreciative of hearing a lot of different perspectives from different countries. I'm pretty well traveled, but I haven't been to the land of Wanda, down under, as it's referred to. So, Greg, it was great to hear your perspective. Great to hear from Thailand. Also great to hear from Ukraine, all places I haven't been. I think this is a really important project. I'd like to tip my hat to Massimo, Dr. Barra, without whom none of us would really be here and talking. He's a giant in the field, and I'm very appreciative that he brought the Rome Consensus process to my attention. Ben, it's a true pleasure to partner with you on this, and I look forward to working with everyone going forward. So thank you very much for your time and attention to this really important issue.
And thank you for letting us sneak up on you for a word. Finally, we all want to thank the attendees for coming and for supporting the work that we're doing. And we really want to pay a special thank you to Dr. Massimo Barra, who's been treating individuals who use drugs for half a century. And thank you so much for, again, your bold leadership, your courage, and your humanitarianism. The work that you do is legendary inside and outside of the Red Cross. And we're just extremely humbled to support the work that you have done and that you continue to do to this day. So stay tuned for other events. You can find all of us on social media, particularly Rome Consensus, and we look forward to seeing all of you again soon at the next event. So thank you so much.
Thank you. Very glad to see you. Thank you very much.
Thank you,
Bye.
everybody.
Grazie tutti.
Thanks, everybody.
Thank you.
Bye.